everyone, here I am going to talk about the anatomy of cerebrum. In this section I will be explaining its external features, important sulci and gyri and the functional areas. Here this is the lateral view of the brain. Here this toes anteriorly, here this toes posteriorly. Here this is the cerebrum. You can see the cerebellum and the brainstem also. Here toes anteriorly, this part is the frontal pole. Here toes posteriorly, here this pointed part, that is the occipital pole. The anteroinferiorly here, this part is the temporal pole of the cerebrum. Then here you can see here there is one lateral sulcus. This depression here, this forms the lateral sulcus. Here this is the superior view of this cerebrum. You can see there is a median one fissure is there that forms the longitudinal cerebral fissure or this median longitudinal cerebral fissure. There is the right here, this is the left cerebral hemispheres. Okay, so this is the right and this is the left cerebral hemisphere. So each cerebral hemispheres are partially connected by means of commissural fibers that forms the corpus callosum. You can see deep to this fissure. Okay, so these right and left cerebral hemispheres are partially connected. Okay, then here you can see here this border, this is the supromedial border. So each cerebral hemisphere has 3 borders and 3 surfaces. So this is the supromedial border of this right cerebral hemisphere. This is the supromedial border of the left cerebral hemisphere. So this is the frontal pole, this is the occipital pole. This surface what you are seeing here, this is the superolateral surface. Then when we take a section through this medial longitudinal fissure, so this is the sagittal view of the brain. Here you can see this is the supromedial border. Here this is the infromedial border. The surface here, this is the medial surface of the cerebral hemisphere. You can see this brainstem and the cerebellum also. Here in this medial surface here, posteriorly, this goes posteriorly, so anteriorly. You can see this is the parieto-occipital one sulcus is there, important one sulcus here. In this medial sulcus and medial surface, this is the parieto-occipital sulcus, which is also extends towards the superolateral surface. Upper of the superolateral surface. Then here you can see this is the superolateral surface of this cerebral hemisphere. Okay, this is the lateral view of the cerebrum. It shows anteriorly. This forms the frontal lobe. Here see the occipital pole is somewhat pointed here posteriorly. This is the temporal pole. Shows anteriorly here temporal pole. Then this sulcus here, this is the lateral sulcus. The surface, this is the superolateral surface. Then here this is the right half, right cerebral hemisphere, shows anteriorly, shows posteriorly. You can see the cerebellum also. The surface, this forms the superolateral surface. Then here again this is the sagittal view. This is the medial surface of the cerebral hemisphere, shows anteriorly, posteriorly occipital pole. This is cerebellum, brainstem is there. This is the parieto-occipital sulcus. This is the medial surface. Then here you can see this is the inferior view of the cerebral hemisphere. This is the left half. This shows anteriorly. This shows posteriorly. You can see this is the inferior surface. There is one sulcus here in the inferior surface. It's the extension of this one, that is the lateral sulcus. This is the lateral sulcus, which divides this inferior surface into this anterior orbital surface and this posterior here. This is the tendorial surface of this inferior surface. Okay. Then again coming to this lateral view of this brain, this is the frontal pole, this is the occipital pole, this is the temporal pole. Okay, we have seen the surfaces, 3 surfaces. This is a superolateral surface. We have seen in the previous diagrams medial surface and inferior surface. This borders here, this is the supromedial border, this is the infrolateral border. The infromedial border also we have seen. Then coming to this lobes here, this is the here in the superolateral surface. Okay, there is one central sulcus is there. This is the central sulcus. This is the lateral sulcus. Then this is the occipital pole. In front of the occipital pole you can see this area this depression here. This is the pre-occipital notch. This is the pre-occipital notch. Here there is an extension of this parieto-occipital sulcus is also coming little to this upper of the superolateral surface. So imaginary line from this parieto-occipital sulcus which joins with this pre-occipital notch. Okay, here we have to draw an imaginary line. So this is the first imaginary line. So this is the lateral sulcus. Imaginary line from this lateral sulcus to the posterior, which has to join with this first imaginary line like this. Then this is the central sulcus. Okay. So with the help of these four structures, so anterior to the central sulcus, this area here, this forms the frontal lobe. Then inferior to this lateral sulcus, then in front of this first imaginary line, and here this imaginary line, here this area, this is the temporal lobe. Here this area here, this is the parietal lobe. Between this central sulcus and this first imaginary line and this line here, then behind the first imaginary line here, this area, this forms the occipital lobe. So these are the three lobes. This is the frontal lobe, this is the temporal lobe, this is the parietal lobe, and this is the occipital lobes. Four lobes of the cerebral hemisphere. So that's about this external features. Then coming to the structure of this cerebrum. So when we take a coronal section here, this is a coronal section, coronal view. They made a coronal section. So this outer area here, this grayish color, this forms the, this is the gray matter. Here, this is the gray matter. Then inner to the gray matter, you can see this is the white matter. You can see this is the white matter. So in deep to this white matter, you can see there are gray matter is there. These aggregations of this gray matter. This forms the nuclei here. This one, you can see this is the nuclei. So they're called the basal nuclei. So there is the outer gray matter that forms the cerebral cortex. Then deep to the cerebral cortex, there is white matter. In the white matter, there is the basal nuclei. Okay. Then you can see this elevations and depressions of the cerebrum that forms this gyrus and the sulcus that is present on the cerebral cortex. Okay, these elevations and these depressions you can see that is present in the cerebral cortex that forms the gyri and the sulci. Here, coming to this importance sulci and the gyri. So this is the superior view. Here you can see this is one fissure. This is the median fissure. That is the longitudinal cerebral fissure. Here you can see in the superolateral surface, this is the central sulcus. In front of the central sulcus here, the central sulcus here, this is a deep sulcus. This is one uninterrupted sulcus here from the superior border, supromedial border towards this here, towards infrolaterally here. Then in front of the central sulcus here, this is the precentral sulcus. Behind the central sulcus, this is the postcentral sulcus. So gyrus between this central sulcus and this precentral sulcus, this is the precentral gyrus. Gyrus between the central sulcus and the postcentral sulcus, this gyrus here, this is called the postcentral gyrus. Okay. Here, again, this is the superolateral surface. This is the lateral view of the cerebral hemisphere. Shows anteriorly frontal pole, posteriorly here, this is the occipital pole. You can see here, this is the lateral sulcus. Here, this is the stem of the lateral sulcus. Here, it's divided into here. It forms three rami, this lateral sulcus. This is the anterior rami, this is the ascending rami. Actually, this is the posterior rami of the lateral sulcus. Okay, this is the posterior ramus of the lateral sulcus. This is the anterior ramus, this is the ascending ramus, and this is the posterior ramus. Okay. Then here, you can see this is the central sulcus. This is the precentral sulcus. In front of the central sulcus, this is the frontal lobe. This is the postcentral sulcus. Behind the precentral sulcus here, this is the parietal lobe. This is the occipital. Here, this is the temporal lobe. So in this frontal lobe, here this is the precentral sulcus, precentral gyrus. In front of the precentral sulcus, there you can see superior and inferior frontal sulcus. Divides into superior, middle, and this is the inferior frontal gyrus. These three areas, superior, middle, and inferior frontal gyrus. Okay. Then, in this inferior frontal gyrus here, this is the inferior frontal gyrus. There you can see the anterior ascending rami of this lateral sulcus. So that area gets divided into part of the gyrus anterior to this anterior rami. Here this area is called the pars orbitalis, that is forms the pars orbitalis. Then between this ascending and this anterior rami, here this part of the gyrus, here this is called the pars triangularis, that forms the pars triangularis. Behind this ascending rami here, this area that forms the pars opercularis. This you can see in this inferior frontal gyrus in relates to this rami of the central sulcus, rami of the lateral sulcus. Here, this is the pars orbitalis, this is the pars triangularis, this is the pars opercularis. Okay. You can see here, this is the central sulcus. Then, coming to this temporal lobe here, this is the temporal lobe. Can see there is the superior and inferior temporal sulcus is there. This is the superior, middle, and inferior temporal gyrus is there. Okay. Then, so this is the central sulcus. Here you can see this is the postcentral sulcus in the parietal lobe. This is the postcentral gyrus. Behind the postcentral sulcus here, there is an intraparietal sulcus is there, like this. Okay. That gets divided, that parietal lobe, into superior, and this is the inferior parietal lobule. Okay, you can see this part is the gyrus that is named as superior, and this part here is named as inferior parietal lobule. Okay. Then, in this inferior parietal lobule here, you can see in the inferior parietal lobule, there is extension of this posterior ramus of the lateral sulcus is extends towards there, and this gyrus here, this is named as supramarginal gyrus. There is also the extension of this superior temporal sulcus is there. So this part of the gyrus here is named as the angular gyrus. So there is the supramarginal gyrus and this gangular gyrus. This is the supramarginal gyrus, this is the angular gyrus that is present in this inferior parietal lobule. Then in the occipital lobe, here you can see there is the lunate sulcus is there. This is the lunate sulcus. There is also this extension of this parieto-occipital sulcus also you can see. So this is the lunate sulcus, this is the parieto-occipital sulcus. Then there you can see this is the transverse occipital sulcus. Here you can see this is the transverse occipital sulcus. So these are the important sulcus and this gyri on this superolateral surface. Here, coming to this medial surface of the cerebral hemisphere, this is sagittal view. Stores anteriorly, stores posteriorly. Here you can see this is a corpus callosum. Here, surrounding this corpus callosum here, this is the callosal sulcus. Superior to the callosal sulcus, you can see here, this is the cingulate sulcus. Okay. The part is extending superiorly above the cingulate sulcus. This forms the marginal sulcus. Then you can see the central sulcus extension is also there towards the medially, little of the central sulcus that you have seen in the superolateral surface. So this is the part of the central sulcus. Then this area of the gyrus here, superior to this cingulate sulcus, this forms the cingulate gyri. This is cingulate gyri. Then here you can see posteriorly there is the parieto-occipital sulcus, this one. Here inferior to the parieto-occipital sulcus, this is the calcarean sulcus. Between the parieto-occipital sulcus and the calcarean sulcus, this area of this gyrus here is named as cuneus. Okay, that is the cuneus. In front of the parieto-occipital sulcus and behind this marginal sulcus, this area here, this is named as precuneus. Then inferior to the calcarean sulcus here, this part of this gyrus here, that is named as the lingual gyrus. Here it is the lingual gyrus. Then this is the central sulcus, small part here extends to the medial surface. So this part of this gyrus here, this is named as the paracentral lobule. This is the paracentral lobule. Then here in front of the paracentral lobule, this part of this gyrus here, that is named as the medial frontal gyrus. Okay, this is forms the medial frontal gyrus. Okay, these are the important sulci and this gyri on this medial surface. Then coming to this inferior surface, you can see here this is the inferior surface, choose anteriorly. This is the frontal pole, this is the occipital pole. Okay, this is the temporal pole, this is the infromedial border. Here you can see this is the infrolateral border. So this is the inferior surface, this is the anterior orbital surface, this is the posterior tendoral surface. So in this orbital surface and this tendoral surface, so where is, okay, so in this orbital surface you can see medial, there is one olfactory sulcus is there which lodges this olfactory tract. This is the olfactory tract is there in this left half. Here this olfactory tract is cut, they can see the olfactory sulcus medially. Then lateral to this olfactory sulcus, there you can see irregular one, H-shaped one sulcus, okay, which divides here this lateral area into anterior, lateral, posterior and medial orbital gyrus. Okay. Medial to this olfactory sulcus, this area here, this gyrus is named as the gyrus rectus. Okay, that is the gyrus rectus. Okay. Then here in this tendoral surface here, you can see this is the lateral sulcus. Then medial most one sulcus is there. This is called the collateral sulcus. Okay. Anterior of the collateral sulcus here, it's named as the rhinal sulcus. Then lateral to this collateral sulcus here, this is the occipitotemporal sulcus. Then medial to this collateral sulcus, the part of the gyrus here, it's named as parahippocampal gyrus. Lateral to that, this gyrus is named as medial and lateral occipitotemporal gyrus. Okay. Then here there is a hook shaped part here towards anteriorly medial to this parahippocampal gyrus. This is named as ungus. Okay. So that's about this sulci and the gyri on the inferior surface. Then here you can see this is the midbrain section of this midbrain. Okay. Here you can see this is the optic nerve, here optic chiasma, here this is optic tract. Here you can see this is the hypophysis cerebri, pituitary gland. This is the mammillary body. This is the anterior and posterior here perforated substance. Okay, perforations for this blood vessels. Then, so that's about this sulci and this gyri on this inferior surface. This is in the medial surface. Then here this sulci and gyri on the superolateral surface. Then next is the functional areas of this cerebrum. So here, so this functional areas here, it's present on the cerebral cortex. So we have seen the outer gray matter, okay, that forms the cerebral cortex. So it's there in this cerebral cortex. So this function of this functional areas here, which controls all conscious thoughts and intellectual functions. That means it processes incoming sensory information and outgoing motor information. Okay, so you have seen there are some numbers are there. So these are the Brodmann's classification. This forms the Brodmann's classification of numbers for the functional areas of the cerebral cortex. We are following this Brodmann's classification. Okay. Here you can see this is shows anteriorly, posteriorly. Here this is the superolateral surface. There you can see this is the central sulcus. Here this is central sulcus. This is the posterior rami of the lateral sulcus. This is the anterior rami. This is the ascending rami. This is the lateral sulcus. Okay. Here you can see there is an imaginary line from this pre-occipital notch, this parieto-occipital sulcus. Okay. So there is occipital lobe. Here this is the temporal lobe. Here this is the frontal lobe. Here this is the parietal lobe. Then, so in this coming to this frontal lobe here, there is a prefrontal gyrus here that is marked by this area number 4. Okay, that is the primary motor area. So this is the area number 4, which is responsible for this movements in specific parts of the body. That means it controls the voluntary motor activities of the opposite side of body. Okay, that is the primary motor area. This area number 4. Okay, so lesion of this one causes which leads to hemiplegia of this opposite side of body. Then in front of this primary motor area, you can see there is a premotor area that is marked by this area number 6. So here this is the superior, middle and inferior frontal gyrus. Posterior of this inferior frontal gyrus forms this premotor area marked by area number 6. Okay, that is the premotor area, which is responsible for this programming and planning of movements. Okay, that is for the performance of the skillful movements. Okay, that is like learning to write and playing a piano. Then, so this lesion will produces here difficulty in this skillful movements. Okay. Then you can see here there is an area number 8 on this posterior of this middle frontal gyrus that forms the frontal eye field, which is responsible for this conjugative movements of this eye. Okay, activation of that one produces the conjugate movements of the eye. So you can see here this is the eyeball here. This pupil will be there in the center. If the pupil moves towards laterally on opposite planes, both pupils move laterally, that produce laterally or towards medially, that is towards the opposite poles, that produces the conjugate moments. Okay, so the activation of this frontal eye field which produces the conjugate moments. Okay. Then in front, okay, to the anterior of the superior, middle and inferior frontal gyrus, there is the area number 9, 10 and 11 which forms this prefrontal area. Okay. Here this prefrontal area is responsible for this one's personality. Okay, it's responsible for its emotions, its moral and concentrations. Okay, that is mainly its behavior. Okay, so any lesion will causes changes in personality. So that is the area number 9, 10 and 11 here that forms the premotor areas. Okay. Then this temporal lobe here, you can see there is the area number 20. This I will discuss later. Okay, temporal lobe. Okay, then in this inferior frontal gyrus here, you can see this area number 44 and 45 is there. Okay, so this area number 44 and this 45 here, this one you can see in this pars triangularis and this pars opercularis here. So with this forms, this one is the motor speech area here. This is the motor speech area, area number 44 and this 45. Motor areas of this Broca's speech area, which is responsible for the production of expressive speech and this vocalization. Okay. So lesion will produces this one aphasia, expressive aphasia. okay, difficulty in this producing this expressive speech. This is the broadcast speech area. This is the motor speech area, area number 44 and this 45. Okay. Then, so behind the central sulcus here, this is the postcentral gyrus. There you can see this area numbers 3, 2, 1. This is the primary sensory area. Okay. So in this precentral gyrus, the area number 4, that is the primary motor area. In the postcentral gyrus, that area number 3 to 1, these are the primary sensory area. So this primary sensory area, which one is responsible for this perception of this exteroceptive, like pain, touch and temperature sensations, and this proprioceptive sensation like this vibrations, muscle and this joint sensations from the opposite side of the body. Okay, that forms that is the function of this primary sensory area. Then you can see in this parietal lobe, there is a superior parietal lobule that is represented by this area number 5 and 7 here. These are the sensory association area. So the sensory association area, which is responsible for the perception of the shape, size, texture and the roughness of the objects. Okay. So this in lesion or this any lesion of this area produces difficulty to identify the object. Okay, that is the function of this sensory association area. This area number 5 and 7. Okay. Then so in this figure you can see the temporal lobe areas. So in this superior temporal gyrus, you can see this area number here 41 and 42, that is the primary auditory area. So this primary here, this one auditory area will detect the source of the sound, okay, and its loudness, quality and pitch of the sound, okay, everything. Then here the secondary auditory area or this auditory association area, that is the area number here 22 here. This is the function of this area here, which the secondary auditory area or this auditory association area, which receives this auditory impulses from the primary auditory area, and also it correlates with the past auditory experiences. Okay. Then so any lesion of this here, this area will lead to this inability to interact the meaning of the sound heard. Okay. So that's about this primary auditory area, area number 41 and that's 42. Then this auditory association area, that is area number 22 here. Then in the occipital pole, you can see there is the primary visual area here, that is the area number 17 here, that is which is responsible for this perception of this vision. Then visual association area or the secondary visual area, that is area number 18 and this 19 here, which this 18 and 19, which is important for the perception and understanding of what is seen, okay, and remembering what was seen before, okay, that correlating with this previous visual experiences. That is about the secondary visual areas function 18 and 19. Okay. Then coming to this sensory speech area, here you can see that is the area number here, that is the 39 and 40. 40 is there in the supramarginal gyrus, 39 is there in this angular gyrus. Okay, that is the sensory speech area or this speech area of this vernix. Okay, vernix area. Here, this one here is responsible for this understanding the speech, okay, and this important for reading words and this writing. Okay, that is the function of this sensory speech area or this vernix area, that is the interpretation of the languages, okay, which helps in this interpretation of the languages. So that's about this important functional areas. Okay, here you can see this is the primary motor area in this prefrontal gyrus, area number 4, okay, which is responsible for this voluntary activities of this opposite side of the body. Here we're talking about this one half of the cerebral hemisphere. Okay, so this is the left cerebral hemisphere. Here you can see this is the 3 to 1. This is the sensory areas, primary sensory areas here. That is in the postcentral gyrus, which is important for the perception of this exteroceptive and proprioceptive impulses from the opposite side of the body. Okay. That's all about the cerebrum. Here is the question. Describe the external features of cerebrum with the sulci and gyri on the superolateral surface. So we have seen this important sulcus and this gyrus on the superolateral surface. Okay. Hope you understood. Thank you.